Welcome to AFD TV. I'm Dr. Steve Samudrala, and I'm here with allergy and asthma specialist, PA Neil Grossman. Welcome, Neil.
Thank you. Very happy to be here.
One of the biggest challenges with allergy and asthma is finding what triggers this. What are some of the best ways to find these triggers?
The best way to find what your trigger is and how severe your trigger is by testing for it. And there are two types of tests now. There's the skin prick test, in which an allergist will puncture the skin with 40 to 70 specific needles with specific allergens on them, have the patient wait 30 minutes, bring them back into the office to see if they have a reaction on their skin to one or more of those allergens. It would be a red, raised, itchy, hive like reaction. The other method is one blood draw. It's a blood test, any time of day, any time of year. And what we produce with that blood draw is a panel of similar allergens that are on the skin prick test, and we determine what somebody is sensitive to by what comes up as positive on that lab test.
Can most doctors do this blood test?
It is available to every type of clinician, nurse practitioner, PA, a primary care doctor, pediatrician, allergist, ear, nose, and throat specialist. It's available to any clinician that use the test.
Great. And how does a blood test work?
Well, there are two types of blood tests. There was an older test called RAST, R-A-S-T, which was developed in the early 1970s because there was a need to find out if a patient's runny nose was actually caused by an allergy. But it wasn't very sensitive, and allergists could only use skin prick testing. Years later, ImmunoCAP was developed, and now the test is so sensitive that it is consistent with skin prick testing. So the allergists, or now the primary care doctors, use ImmunoCAP, and we know that the results are interchangeable, either skin prick testing or ImmunoCAP testing.
Great. What does the blood test for?
The respiratory profile of ImmunoCAP tests for what is most common in this area of the country. The very specific trees, grasses, weeds, ragweed, dust mites, mold, animal danders, cockroach, things of that nature that a patient may be sensitive to with diseases like a runny nose, rhinitis, or especially with asthma.
Great. Very helpful in this season and the steady rise we're seeing in allergy and asthma. Best way to treat this is prevention. Thank you for watching AFD TV, and stay tuned for more great information.
The preceding advice provided in this video is informational and strictly the opinions of Dr. Samudrala and AFD Clinics. For a more accurate medical opinion of your personal health, please consult your primary care physician or visit one of AFD's clinics today.